everyone, thanks for tuning in. It's Jacqueline DuPont, the Gerontologist, talking today about ageism in the healthcare setting. I am currently writing a paper, of course an academic paper, on ageism in the healthcare setting. And what I'm realizing in my literature review is there is a lot out there. A lot has been written on this critical topic. And back in the 80s and 90s when I was in graduate school before, there wasn't a lot written on it, but now, thanks to some famous authors and wonderful researchers, we have a lot out there to say 1 in 4 older adults feel ignored, demeaned, just discriminated against in a healthcare setting, such as the doctor's office, the ER, the hospital, the acute care setting, the skilled nursing. They feel very demeaned. One term that comes up quite a bit is baby talk, talked down. Another term is they're talked in front of. So they'll be talking to another person right in front of them like they are dead, but they are alive, and they feel very, very demeaned is the word that keeps coming up. And then of course there's stereotypes, and there are so many physicians out there from the research I'm reading on stereotypes of older adults. And so because of those stereotypes, you have self-fulfilling prophecies occurring where the older adults really going to become like they're being projected by this doctor, or they're ignoring symptoms. Most complaints you're seeing in the literature on studies they are ignored. Their symptoms are ignored because that's just normal aging, or they're over-treated due to maybe financial gain. I'm not sure. I'm still researching the over-treatment. I'm reading more about under-treatment, just ignored symptoms, which in the end costs us more. Because if you're ignoring their complaints and not getting to the root cause analysis of them, they're ending up in the ER, which is costing our country more in a healthcare setting. So these various ageist stereotypes and discriminatory behaviors have really harmed our older adults. And one key thing I read just last night was so interesting. Why doesn't every medical school have a requirement that students have to take geriatrics? They don't have to rotate in geriatrics, and they don't have to take a geriatric class. Only 24% of medical schools actually have as a requirement. So that needs to change, and we really need to start with our interns and our medical schools to really let them know that this is a value that our country really supports, that we love and respect and honor our older adults. Thank you for tuning in.